Welcome to Deep Dive Dialogue on Pharmacogenomics in Precision Medicine, Bridging Genetics and Drug Therapy. Pharmacogenomics in precision medicine integrates genetic insights to optimize drug therapy, ensuring effective and personalized treatment. By understanding genetic variation influencing drug metabolism, efficacy, and toxicity, clinicians can tailor therapies, reduce adverse effects, and enhance outcomes. This approach brings genetics and pharmacology, transforming treatment strategies across various medical disciplines. To discuss this topic, we have with us Dr. Chenika Gupta. She is presently working as scientific curator at Indus Health Plus. Welcome, Dr. Chenika.
Thank you so much, Dr. Manisha. Thanks for providing me this opportunity. I'm truly grateful to you.
So, Dr. Chenika, first of all, I would like to ask you that can you explain in simple terms that what pharmacogenomics is and why is it important and how it helps doctors choose the right medication for their patients?
Yeah, so to begin with, let's imagine there are two people who are diagnosed with same medical condition and are being treated with same medicine. So here something different and surprising happens. What happens is in first case, there is a very good response and person get well of a time. While in other person, what happened is there was no response and he also developed serious side effects. So there are different reasons to this, like age, gender, multiple illnesses they might be having, and genetics. So we all know that we are unique because we carry genes from our parents. Genes are the segment of DNA that controls every aspect of our body, like our eye color, hair color, height, also the way we respond to different drugs. So when you pop up a pill, it has to be metabolized in your body so as to produce the desired effect. However, certain genetic variations in your body can affect the way you respond to different medicines. For example, you might have seen that some people might need higher dosage of medicine while some need lower dosage of medicine. And this is all because we all are genetically different. So to sum up, pharmacogenomics is the branch of science that studies how your genes affect the way you respond to medicines. Now, moving towards the second part of your question, like how is it helping doctors to choose the right medication? So, as you know, most of the drugs are designed for the generalized population, following one size fit all or one dose fit all approach, which means that the same dosage or same treatment will work for everyone. You can compare this to the products like your clothes or accessories, which are designed for the general population, irrespective of their needs, their size, or shape. So, uh, now I want to share with you some important, amazing facts. That around 60% of individuals have been prescribed with at least one medication. Nowadays, it's been so common. Even youngsters and adults, they are being prescribed with even one or two medicines. And heart attacks are so common nowadays, as you know. And most of the drugs are ineffective in 20 to 75% of individuals. And also, adverse drug reactions and side effects is the leading cause of death in India. And India stands in fourth number in that. And this also leads to so much burden on hospitalization in our healthcare sector. So, recently, the research has been conducted on Indian population where it has been found that each individuals carry at least one pharmacogenomic variant that can guide relevant changes in their prescription. So, if doctor knows about your genetic information beforehand, they can choose right medication and right dosage, which is designed specifically for you as per your genetics. And this could help in overall minimizing the side effects or adverse drug reaction, toxicity, and also saves times by eliminating trial and error. And this also leads to overall treatment being more effective and safer, and thus makes it very cost effective.
Right. I agree that we can definitely defer the adverse reactions and definitely choose the right dose depending on the genetics of a particular patient. So my next question would be that what are the key pharmacogenomic markers that clinicians should be aware of when selecting drugs for patients?
Yeah, so genetic factors play a major role in determining how we respond to medicines, and they contribute about 20 to 40% of difference in the way we metabolize drugs. And adverse drug reaction is one of the leading cause of hospitalization. And it has been seen that recently in researches, it has been found that genetic testing has reduced this risk of ADRs to 30%. So, pharmacogenomics can help you to personalized how you respond to drugs depending on your genetic makeup. So, as you mentioned, why pharmacogenomic markers are important. So, pharmacogenomic markers are basically genetic markers that can help you predict the way you respond to drugs and how you can, by knowing this, how you can minimize the side effects. So one of the key family of enzymes, which clinicians should pay much attention to, which is CYP450 family of enzymes, because this is broad category of enzymes which play important role in metabolism of huge range of drugs that belong to wide therapeutic areas like anticoagulants, antidepressants, pain management, painkillers, and cardiology drugs. So I want to explain this by citing two examples which are falling under this category. First one is CYP2C9 gene. CYP2C9 gene is involved in the metabolism of warfarin, which is used as blood thinner to prevent blood clots. So genetic variation in CYP2C9 can can influence the way you metabolize warfarin. It can either make you more sensitive to warfarin, thereby increasing the risk of bleeding. So, depending on what variant you are carrying, you might be need higher dose or lower dosage of warfarin, depending on how your body is going to break it down. Another family of CYP2C gene is CYP2D6. CYP2D6 is an enzyme which codes for CYP2D6 enzyme, which is responsible for metabolism of painkillers like codeine. You might have heard of it. So genetic variation in this gene can affect the metabolism of like painkillers. So it can either lead to side effects or make it ineffective if the particular variant is present in those individuals. And there are also other pharmacogenomic markers which are of key importance, like SLCO1B1, which is involved in the metabolism of statins, VCORC1, that is also involved in the metabolism of warfarin, TPMT, which is involved in the metabolism of mercaptopurine, azathioprine. These drugs are commonly used in autoimmune conditions. And like DPYD, which is used mostly in case of chemotherapeutic agents like 5-fluorouracil.
Correct. So we have seen that anticoagulants and even the painkillers, the pop-up painkiller, commonly that we don't know that how we are metabolizing it in our body. And definitely knowing the genetics and genes involved in its metabolism, we can tailor the treatment. So moving on to oncology, how has pharmacogenomics impacted the choice of chemotherapeutic agents? And what are some examples of drugs where genetic testing has significantly changed the treatment protocol?
Yeah, so in oncology, pharmacogenomics has made a huge difference. Some people cancer drug goes well off with, while in some people adverse reactions have been seen. So this happens because different people process drug differently, obviously because of difference in the genetic makeup. So PGX in such cases will act as roadmap to guide clinicians like which chemotherapeutic drug will work well for which individual depending on their genetic information. So the most commonly used drugs that have been, I'm going to cite some examples where it has been seen. For example, for most commonly prescribed chemotherapeutic drug 5-fluorouracil, it is being metabolized by DPYD gene. So genetic variant in DPYD gene will affect the metabolism of 5-fluorouracil, and it has been seen that individuals that are carrying this variant, they might have been affected with serious side effects like skin issues or stomach issues. So if doctor knows about this thing beforehand, like this person is carrying variation in DPYD gene, so accordingly they can choose alternative dosage or change the dosage of that, either reduce it so that it not show severe side effects. Recently, you might have heard this case of Dr. Anil Kapoor, who have been diagnosed with stage 4 colon cancer. He was pre-screened and got the approval to receive 5-fluorouracil because this is most widely used chemotherapeutic drug. Now, what happened is he underwent genetic testing but the variant that he was carrying was ethnicity specific,
Mhm.
and that was not included in the pre-screening. As a result, what happened, as soon as he took the first dose, he suddenly developed toxic reaction and he died all of a sudden, which was a huge shock for whole like clinicians and whole community, because this is the most widely prescribed drug. So if he had been underwent preemptive screening beforehand, so doctors might be knowing that he's sensitive to this drug and they might have choose some other alternative drug or might have reduced the dosage of that drug. So in this way, it is very important to implement pharmacogenomic and preemptive testing in clinical setting so as to avoid this adverse drug reaction, and this can also save lives of so many people.
Correct. So, you have mentioned preemptive testing. I would like to know that how is preemptive testing different from reactive testing, and why is it often considered the better option?
Yeah, so this is very important thing. So now reactive setting diagnosis is done first and then followed by genetic testing, which is usually mostly done in most of the clinics. So this I'll explain it with an example. Imagine you started a medication and after some days you started feeling rashes and swelling, allergic reactions to it. So you go to your doctor, and your doctor, after looking at this symptom, he guessed that you might develop some allergic reaction to it and recommend you to go for a genetic testing. So after getting the genetic test, through your report, he says that you are very much sensitive to that particular medicine. So accordingly, he change your dosage, reduce the dosage, or provide you alternative drug for the same, uh, for which you are seeking the treatment. So here, what is happening is you undergo so much pain, like adverse drug reaction is there. Also, it will add on the cost of your treatment. So here, the problem happen first, and then doctor will solve the uh, problem. So here, it's like looking at the symptom first, and then going to the root cause, like why it's happening. So this is more of a reactive setting, and it is a curative kind of model, though and usually it involves single gene. It don't take much genes into account because it's very specific, and though it's from far away it looks like it's very cost effective, but it offers you short term benefits, and along with that it, like add on will be adverse drug reactions might be there. While what happens is now in preemptive setting, genetic testing is done first, and then you are going to be recommended with treatment or different drugs, whatever, for what you are going for. So, for example, you have to start taking the dosage of warfarin, which is usually a blood thinner. So, your doctor will first recommend you to go for genetic testing to test for the genes, whether you are sensitive to warfarin, like whether you are at risk of bleeding, or you need higher dosage or lower dosage of warfarin. So, accordingly, he will decide. And after getting the report, it showed that you are very much sensitive to warfarin. So, what he will do, he will start with the lower dosage so as to prevent the risk of bleeding. So, overall, this will save your time, that hit and trial the doctor will do, and overall cost. Though initially, obviously, PGX testing people feel like it's very costly because test cost around 10 to 15,000. But if you see in long term, it will be beneficial for you because while when somebody gets ADRs and hospitalization cost is so much more, and the pain and suffering one has to go through is very much. So, in a broader way, if you see, preemptive testing will be much more beneficial. And now it is high time to shift from reactive testing to preemptive testing because it is more on the preventive side.
Right. I agree that, and we should lay stress on prevention rather than curing. My last question would be that how can pharmacogenomics be used in everyday clinical practice, and how can it be integrated into healthcare to help doctors make more personalized treatment choices for their patients?
Yeah. So, pharmacogenomics nowadays is being used every day in healthcare, and because with the emergence of many genetic testing companies like 23andMe, Invite, Indus Health Plus, and many more. So, these companies provide you genetic tests that will help doctors to understand which medicine will work best for you as per your genetics. So, for example, Indus Health Plus is providing you genetic testing across 115 specialties under 17 categories, which include all the major categories like anticoagulants, cardiology, antidepressants, painkillers. So if somebody is going to be on medications like painkillers, so if they undergo this genetic test, they might preemptively they might be knowing which they can tell the doctor this is our report and this medicine will work for us and this will not, and accordingly doctors can decide which medicine to prescribe. So, and also, according to recent stats, it has been seen that in USA, 20% of medicines which have been prescribed are based on pharmacogenomics guidelines. And also, there are organizations like CIPIC, FDA, PharmGKB who are providing evidence based guidelines so that it is easier for clinicians to translate genetic data to clinical actionable decisions. And there are many countries like Netherlands who are providing PGX passport. So their individuals can go for preemptive testing, and whenever prescription is needed, clinicians can know like what are the PGX recommendations, and this could obviously overall save their time and cost and adverse drug reactions and that hit and trial method. And moving towards next question, how it can be integrated to healthcare system. So there are various ways. First, basic is like genetic testing report can be integrated to the medical history of the patient, so that when doctor goes through basic details of the patient, he can go through the genetic testing report, and while prescribing medications, depending on his genetic makeup, medicines can be prescribed. And another is by integrating this genetic information into the HRIS or LMIS of the hospitals. So again, whenever patient visit, rather than taking report by hand again and again, doctor can just feed his data and that report is there. So along with his basic details, this would be additional factor so that while prescribing medicines, doctor can like check which medicine will work for him or which will not, which will cause adverse drug reactions. So this is going to be win-win for both clinician and patient. Thank you.
Yeah, correct. So I also believe that by integrating pharmacogenomics into our healthcare practice, we can definitely make medications more safer, more effective. And I think research work and teamwork can open more ways, more paths for a better outcome for the patients. Thank you so much for joining, Dr. Jamil.
Thank you. Thank you so much.